Dr. Daniela Munene, who is the CEO from the Pharmaceutical Society of Kenya. It's good to have you, Dr. Well, next to her is Dr. Silvia Opanga, who is a clinical pharmacist as well as a lecturer at the University of Nairobi. It's good to have you as well. Of course, our discussion today will be focusing around medical negligence, of course, coming at a time when we've seen an incident at Shalom Community Hospital. And just before we begin the discussion, let's just quickly take a look at the latest update from that particular hospital. And it is now imagined that Shalom Community Hospital in Machakos County lacked specialist pharmacists to handle drugs classified under the risk-based schedule such as morphine. Now, Pharmaceutical Society of Kenya says patients using morphine should be closely monitored, unlike in the case of the 7-month-old baby who died after being given the medicine. Let's take a look.
The 7-month-old boy who died at the Shalom Community Hospital after allegedly being injected with a lethal dose of morphine grieves and demands justice. Medical experts now say the facility does not have specialist pharmacists.
In this unfortunate occurrence in Machakos, the medicine that caused the fatal incident was morphine, a drug classified as a controlled product that should be handled only by a qualified pharmacist who adheres to a professional code of conduct. Medicines are poisons and should be handled by the right professionals to provide benefit without harm.
According to the Pharmaceutical Society of Kenya, the medics at the hospital erred in discharging baby Ethan Mwendo. The toddler had been taken to the hospital with minor burn wounds.
Unfortunately, the patient was discharged the same night. When you're giving morphine, the cardinal rule is that the patient should be monitored. The baby suffered from difficulty in breathing. The mother reported that, and the patient was drowsy and they were not able to take breast milk. They were not able to suckle. So those will be classic symptoms of a morphine overdose.
PSK is now accusing Pharmacy and Poisons Board for giving operational licenses to unqualified persons and thereby endangering the lives of innocent Kenyans.
Regulators are giving licenses to hospitals and pharmacies that don't adhere to this government document, yeah?
On Monday, Health Cabinet Secretary Cecily Kariuki disclosed that the Kenya Medical Pharmacist Board is under instructions to revoke operational licenses of hospitals flouting professional operation procedures in the next 60 days. Kenya Medical Pharmacist and Dentist Board, KMPDB, has already revoked Shalom's hospital's operational license, while Machakos County government withdrew the business permit. Some mistakes cannot be undone. They better serve as an example. The only hope left for Kenyans is that the ongoing crackdown on unqualified experts and facilities will bear fruits. Purity Museo, Channel 1 News, Nairobi.
Of course, that is the latest coming from the initial investigations that have been ongoing in that particular case of medical negligence. And of course, I have with me in studio two ladies who, of course, are from the Pharmaceutical Society of Kenya, as well as a clinical pharmacist who had introduced a little bit earlier. And just stemming from your initial investigations, based on, what you are saying, what really happened at Shalom Community Hospital?
Well, as soon as we saw the reports that it was a medication error, a dosing error to be precise, that the pharmacist provided, quote unquote, pharmacist provided to be administered to this child, a completely wrong dose. We immediately looked into it to see, is it our member? Because we're the professional body of pharmacists, and we do have mechanisms of finding out if somebody is practicing beyond their scope, if somebody needs to be rehabilitated, retrained. But upon investigations, we discovered it was not our member, and it was not even a pharmacist.
It was not a pharmacist?
There was no pharmacist at that facility.
So who administered the killer drug?
It was staff at the hospital, but the medicine was provided from the pharmacy by this personnel who is a non-pharmacist. And the reason it was shocking to us is because this medicine is not an ordinary product. It is categorized as a controlled substance. And we categorize medicines based on risk. And the higher the risk, the higher the caliber of professional you need handling these products. So a hospital has no business stocking such type of medicines without having a pharmacist in charge. We have different cadres of pharmacy practice. We have pharmacy assistants, we have pharmacy technicians, and we are all needed in the ecosystem of providing pharmaceutical services. But the higher the kind of drugs you handle, then you need a pharmacist. Sometimes you even need a specialist pharmacist.
All right, as a clinical pharmacist, given that the child who was brought to hospital, the parents say that they had suffered a burn from water and they scalding, I think. Do you think that perhaps the technician shouldn't have gone ahead and used, morphine, given that you're saying it's a controlled substance, a drug that shouldn't be used every other day?
Morphine is a drug that is reserved for severe pain. Yes. So what could have been done will be assess the patient and look at the levels of severity of pain. There are scores that you can use to say whether a patient has severe pain, do they have moderate pain, or do they have mild pain. Now, once you assess the patient and you do it comprehensively, then it will guide you what kind of painkiller to give. It could have only been justified.
You're doing the assessment with what? With the naked eye? Or
no, there is a criteria that you use. Yeah? There's a clinical criteria that you use to assess pain in patients. Yes. So once that criteria has been observed, then what you need to do is classify the patient. Do they suffer from severe pain? Are they in moderate pain? Are they in mild pain? If they're in severe pain, that's when it's justified to give morphine. Moderate to mild pain can be solved with other painkillers which are not too strong. Yeah, so what could have been required is classify the patient's level of pain, then treat adequately. Yes.
Given that, the person who perhaps was at the clinic, was not a pharmacist in the first place, how did they manage to handle, morphine? How did it get to the hospital?
Well, that I cannot explain, how the morphine got to the hospital, but what I can say is that such drugs will require specialists to handle them. Specialist pharmacists or just pharmacists. But anybody without that level, then it will not be right. Because this is a drug, when it's administered, you need to closely monitor the patient. You don't discharge them on such a drug. You closely monitor them, particularly for their breathing patterns and their sedation levels. Okay? Because what morphine does, it depresses breathing and it also depresses alertness. And I think that's what the mother reported. The baby was getting drowsy, not alert, unable to breastfeed, and they later developed difficulty in breathing. When you're administering morphine, the rule is have your antidote there, have oxygen there, keep the patient monitored. Yes.
So that is what could have been.
And that's what only professionals can pick out. Yes.
All right. As you know, the Pharmaceutical Society of Kenya, I mean, in terms of the number of clinical pharmacists that you have, would you say it's adequate?
That's a valid point, because numbers are a real challenge. The whole universe of pharmacists in Kenya is about 3,800, of which the clinical pharmacists are just under 30. Am I correct?
No, about 150, 200.
About 150, 200 clinical pharmacists. The issue here is not that we need at every little facility to actually employ a clinical pharmacist, but there are supervisory frameworks that have been tested elsewhere and they work, where facilities work under the supervision of another more senior facility with a pharmacist and refer appropriately. So if you don't have the personnel to handle those products, then anybody who needs those products, then refer them to where there's a pharmacist or a specialist pharmacist. That way every patient is well taken care of, rather than taking the risk of managing something out of your scope that you cannot even handle the consequences. Like she said, was there oxygen that needs to be established? Was there an antidote? Was there even somebody who could identify that this is an overdose of morphine? Those are questions that need to be answered by the team that is investigating. I know the authorities are on the ground investigating whether there were systemic failures and who is to blame. Because we cannot say it's negligence until the authorities establish that somebody consciously did the wrong thing or chose not to follow protocol. At this point, what we know is it was a medication error. Medication errors happen. Medication errors are a broad range of errors, including dosing errors. So this was a dosing error. And errors happen every day in medical practice, but we have protocols to arrest the effects of that error. Were those protocols in place?
But this error is costly, given that a life, has been lost. So in terms of, the medical profession itself, how do you prove negligence?
How to prove negligence? I think you have to look at individual factors that would have caused that error to happen. And then you look at, were there any contributing system factors? Once you evaluate those, then you can be able to tell whether it was medical negligence on the part of someone or it was just something that happened due to system issues. So that needs a thorough investigation. It's not something that we can conclude right now because there are many factors that come into play.
Of course, for the family, they want justice.
Yes.
Yeah. So how long do these investigations take when it's a case of, medical negligence or error or whichever term we want to use in the medical profession?
It should not take more than a couple of weeks. There's at least two main boards that are involved in this investigation. That's the pharmacy board and the medical board. An audit of the systems of a hospital should not take more than 2 weeks. So we are eagerly awaiting to see the report of that. Like I said, the issue here is not to castigate any practitioner or any individual because human is to err. But the issue is to identify were there systemic issues that led to, one, the error happening, and two, the error not being detected, and even if it was detected, the damage not being reversed. Those are the things in a health system that we're more worried about, to protect the next person, not necessarily to crucify the one practitioner who probably made the mistake. So for us as a society is, what are those systemic issues that we can fix? And one of the systemic issues is correct staffing. That's a very simple thing. Just staff correctly so that at least you have the right professionals to manage these issues when they arise.
If we look at, in terms of statistics, do we have any numbers that would suggest to show that perhaps we need to address, the staffing issues or what really is happening in the medical field? Statistics to either prove negligence or errors?
Medication and medical errors are fairly common. There are statistics here in Kenya. Some studies have been published, and abroad they are also there. So it's not something that will not happen in any setting.
But what do the numbers look like?
Well, the numbers will depend on what is the facility, where is it. I think we have higher numbers in the developing world compared to the developed world because of the better systems and having professionals in place. Yes. So once we establish that, what are our systems? What are we going to do to reduce these errors? Are we employing professionals to deal with this? Okay. The numbers are there and they vary. But what needs to be done is, do we have systems in place to detect this early before they reach the patient, for example? And even if an error reaches a patient, what do you do to save a life? And studies have shown impact of having professionals in place. Once you have the right professionals and the right systems in place, it's actually very easy to actually mitigate this. Yes.
Of course, statistics have shown that a majority of the times, people die because of perhaps, misdiagnoses, this kind of errors. I mean, how do we correct that? Is it that the training of those we are churning out is not good enough, or is it that the diseases are changing every other day, we are not able to keep up with the metamorphosis?
Training, I think I'll handle that. I'm a trainer. Yes, I train pharmacists at the University of Nairobi, both at bachelor's level and at specialist level. So at the University of Nairobi and other universities that are training pharmacists, the caliber of pharmacy professionals is good. They are trained in clinical practice. They are trained about every aspect of the drugs, from drug discovery to drug production, to manufacture, and then to the use in patients. So I can actually confirm that the training is good. The training actually lasts 5 years, together with another 1-year internship. So clearly 6 years has been spent to train a professional. Now, then we have pharmacy technologists, pharmaceutical technologists who do it at diploma level, 2 to 3 years. And that's why we are insisting that there are levels of practice. So the person with a diploma for 2 years and that one who has done a degree in pharmacy for 6 years and a specialist can only practice at different levels. Yeah. Now in this case, we actually know that there was no person who has been trained very well to handle this.
So this one we can consider it like a quack. Who's
well,
can we classify them as a quack if they were not trained to, to administer the drug?
What I can say is that they are
scope.
practicing beyond their scope of practice. Yeah, because there are different levels of training. Yes.
So in terms of the licensing, what does it take, to be given an operational license to handle the kind of medication that he administered? Is there a procedure?
Well, after the training comes first. And when you do your internship, you need to sit a board exam before you're licensed. So after all that 6-year training, you need to go and sit an exam with the Pharmacy and Poisons Board, and if you pass, then you're issued a license. This license is renewable yearly, and renewal is contingent upon the fact that you have been continuously improving your knowledge and your skills through what we call CPD, Continuous Professional Education. And so as part of that licensing, professional bodies come into play because they are the ones that provide members with opportunities to continuously expand their learning by giving them CPD opportunities. That's what we do as PSK. And then based on evidence that the pharmacist has been training continuously, they go to the regulator and they get their license renewed. And that is how we safeguard the public, by making sure even if you graduated 30 years ago, your knowledge is still up to date. You don't just get a license for life. You're licensed annually. Yeah.
All right. And in the case that perhaps you're cited for medical negligence, or the incident that we're talking about right now, what are the the legal implications for you?
Well, it will depend on the severity of the issue. Was it just an error, or were you as a practitioner negligent? Okay? Negligence is criminal, of course, yeah? But error is to human. So it actually depends on what is the level and what is the impact on humanity. Yes.
Now it brings us back to the family. From the medical point of view, you'll say errors happen, but now how do you tell that to the family, that this is an error and they have lost a child?
Yeah, that's hard. That's pretty hard.
Very hard.
It's pretty hard because somebody losing a family member is painful. Yeah. And what you want, of course, justice, all right? But of course, again, how do you get justice? Find out the root cause. Then you're able to get justice, all right, for the situation. Yes, I can say it's painful to tell that to a family. But of course, all the facts must be gathered to find out exactly what happened. Yeah.
And let the person who was affected by the error not have been affected in vain. The system has to end up being better after that error.
Yes.
And so that we can protect the future patients.
But even as you protect the future patients, and just looking at the compensation in law, what does it say when it comes to such an incident and it's proven to be medical negligence?
I think that's a reason that professionals take indemnity covers, because as a seeker of healthcare, you have every right to question the system that gave you care and possibly harmed you, and it's everybody's right to seek that legal redress. And we do have people who specialize in medical legal issues, and they would better advise such a family. But for us as professionals, our interest is just to make sure it doesn't happen again, to continuously improve the system so that it doesn't happen again. And that is why we are really eagerly waiting for the full report, because right now all that we know, there was no pharmacist and it was a dosing error. But we need the full report from the authorities, who are actually the ones on the ground investigating the root cause. Based on the root cause, we can know if was it negligence or was it just an error. If it's just an error, we can have a bit of grace. If it was negligence, as she said, it's a criminal case. It can be taken to court and the family should be compensated.
But in terms of, the repercussions, are they stringent enough, the laws themselves, to perhaps, get medics to be more careful, when they're carrying out their mandate? To just know that this law, if I'm proven to have been negligent, then the repercussions are dire for me. The laws themselves, are they stringent enough?
I think the laws are stringent enough. Yeah.
We know people who have won court cases in negligence cases. I remember hearing about somebody who thought they got an implant and they didn't get a contraceptive implant and they got pregnant. So people can argue there was no harm, but it was an unexpected outcome.
So who ends up to take care of the child when you had not participated?
Exactly, and those are civil cases. So usually it depends on the strength of your legal team and how you can demonstrate that there was damage and quantify that damage. Yes.
All right, our time is running out, but the question that every Kenyan is asking themselves right now is, how safe am I when I go to hospital? If we can be talking about such cases that someone who was completely not qualified to handle that kind of medication actually had access to it, administered it, and a life is lost. So how safe are we?
That is a very good question, because we all wear white coats, doctors, pharmacists, nurses, laboratory staff. And so I appreciate that to the ordinary Kenyan, somebody in a white coat, it need daktari. So as a professional society, our members wear badges, so the public can look out for the badge to show the Pharmaceutical Society of Kenya membership number. The Pharmacy and Poisons Board also provides a way to authenticate pharmacists through what they call a health safety code, which is put up in every pharmacy that they have license, whether it's inside the hospital or in the community. So we urge Kenyans to use those mechanisms of identifying these professionals. And when you're in doubt, you can cross-check. You can cross-check with the professional society and with the regulator. That is the Pharmaceutical Society of Kenya, the Kenya Medical Association, the Medical Board, the Pharmacy Board. At the end of the day, you're right, your health is in your hands as the patient.
Just to quickly add on that before we end, Kenyans have a right to ask, okay? Don't just go get a prescription, you're given medicine and you have no idea what you're taking. Kenyans have a right to ask. Ask for your pharmacist. Ask, which medicine are you giving me? Does it have adverse effects? What should I do in case I react? Who should I see? You know the basic questions? Yes.
But how many of us even know that a pharmacist is the one who should administer this, or that the level of awareness of
pharmacists
who you
don't
find in
administer,
hospital?
But they're actually specialists in drug therapy. They provide the drugs, but they also should provide information to the patient, very clear information to the patient regarding their medicines. That has not been done a lot, but it is something that Kenyans should actually demand. It is a service from pharmacy that should be provided by pharmacists, so that patients just don't take what they don't know, and they don't know who is giving them medicine, and they don't know whether the medicine will work on them or not, and they don't know the effects. Kenyans have a right to ask, and they must ask.
So in terms of some of the opiate drugs that perhaps we should always know that this has to be administered by a clinical pharmacist. You've talked of morphine. What are the others?
Fentanyl. And then there is, I'm forgetting its name.
You're forgetting the name.
But basically all opioids,
Opioids are the ones that we should look out for.
Yes.
All right.
And we should
and actually, you also need to know that you can safely administer an opioid, but someone will be on other drugs which could potentiate their toxicity or reduce their effectiveness. And that's why I'm saying people should sit down with their pharmacists and have a talk. Because we are the ones with the knowledge that out of your list of 5 medicines, how will they work? Will they work well? Will they be effective? Will they cause adverse effects? Will they react with each other? Are they even cost effective for you? That's what we do. So, and again, the good thing that I like about PSK, we've started the Green Cross initiative, and part of it is pharmacy consultations with patients. We are no longer about mbili mara tatu. We are about providing you the drug after we have explained everything with you. We sit down, the way we are sitting down now, that's where we are headed.
Exactly.
But even as we are headed there, we see people, just walking into pharmacies and beginning to get free consultation and buy medication off the counter. I mean, is that safe?
As a society, we do not condone that. As we said, medicines are classified into schedules, different categories. 4 to be concise. So the top 2 categories, that is prescription-only medicines and controlled substances, there should be a record that the patient is on this medicine. Therefore, this business of going to demand from a pharmacy drugs without a prescription, you're doing harm to yourself. At the end of the day, your health is in your hands, and you need to know that you know, for this type of medicines, I need to go and be evaluated.
Before
so that yes.
All right, ladies, unfortunately our time is up, but thank you very much for coming to our studios and of course sharing with us insights on what really happens, and especially the one of we need to sit down with the pharmacist to tell us what really we are getting.
Yes, please. You can even look for me. We can talk. You can look for Daniela. We can talk. We provide
free
those
consultations. We like that.
Yes, yes, please. Kenyans need to know this.
All right, it's time for us to wrap up the show. Your health segment, of course, our focus of discussion, medical negligence coming from a very sad incident, a 7-month-old losing her life as a result of a drug that was administered to her. And unfortunately, it wasn't a professional who actually administered the drug. So stay alert. That is Dr. Daniela Munene, from the CEO from the Pharmaceutical Society of Kenya, as well as Dr. Silvia Opanga, a clinical pharmacist and University of Nairobi lecturer, putting these issues into perspective for us. We end your health segment, but business news is up next.